Thank you. I'll introduce the next speaker. So next up is Ms. Jesslyn Huang. She's head of TCM care team and consulting TCM physician, practicing at Doctor on Click. She oversees the overall operations of telemedicine platform for the TCM department. Doctor Plus Wellness Private Limited is a Singapore-based company that has developed an integrated healthcare workflow platform, Doctor on Click, bringing healthcare needs under one virtual banner, thus enhancing workflow efficiencies, improving patient outcomes, and reducing healthcare costs through virtual doctor and therapy visits. So in the next few years, they plan to expand and become the premier online medical healthcare company in Southeast Asia, India, Europe, and Latin America. She will now share more about seeking a digital tool for remote TCM consultation and diagnosis. So
Hi.
joining her is, sorry, joining
Oh,
her would also be, I think, for the Q&A session will be CTIO, Chief Technology Innovation Officer at Dr. Unclick. So over to you, Justin. I'm sorry.
no worries. Hi,
Welcome.
very good
Warm welcome.
afternoon to all. So I'll be sharing the screen from my side.
Yes.
Okay, wait, it's a bit laggy. Okay, hi. So for this OIP challenge, Doctor Plus Wellness is working with TCM community in Singapore to look for a solution, a TCM tongue analyzer for remote TCM consultation and diagnosis. So here's our background information. I'm sure that COVID-19 has greatly affected everybody. The social distancing measures taken has accelerated the need for digitalization of the healthcare industry. So this has come with many challenges, especially for TCM, due to our unique diagnostic method. So currently, TCM teleconsultation mainly uses online tools, video and call tools, email, which are inadequate in capturing the patient symptoms accurately and affecting the efficacy of the diagnosis and the treatment. So here are the problems that we face. TCM has four main diagnostic methods, namely 望闻问切, which means to observe, hear or smell, question, and to palpate. So essentially, we use our senses to collect all the necessary information for diagnosis. Without face-to-face information, without face-to-face consultation, the information that we get is limited. So one of the more unique things that we observe is the tongue. So from the patient, we observe the shape, the size, the color of the tongue, the thickness of the coating on the tongue, and the teeth mark at the side of the tongue, or even the vein underneath the tongue. So this gives us an insight on the body. However, the image of the patient tongues given are often inaccurate due to like the low resolution, low image quality. Different lighting, angle, or filter will also affect the actual image of the tongue. And then as you can see from the image here, this is actually the image of the same tongue. Different color filter actually affect our diagnosis result. And TCM practitioner also have to juggle between various mediums for different part of the consultation. So for example, using WhatsApp or emails to request the tongue image, and then we will use Zoom for video consultation and manually update the information into the clinic medical record system. So we are all looking for this solution to improve the teleconsultation process, namely the plug and play integrated digital tongue image capture, analysis, and database solution. So this solution should cater the needs for both patient and TCM practitioner. So for patient, they can easily upload their tongue images for tongue analysis and respond a list of questions prior to the consultation. For physician, they can receive a correctly white balancing image and system-generated analysis by the AI engine that is integrated in the tongue analyzer prior to the consultation. And the solution also allow the physician to acknowledge the analysis of the result, and the information can be captured into the clinic EMR system. So here are the details of what we needed for the solution. First, and most importantly, the solution must be able to guide and assist patient in taking the accurate image of the tongue via the mainstream smartphone cameras. So this could actually include having the framing brackets in the user interface to guide the patient to accurately position the tongue and capture different views of the tongue, preferably in 3D image. And then auto editing of the captured image to ensure that they have correct white balance for accurate diagnosis. Ideally, the tongue captured should look as close as how they are in the real life. Second, it could have a visual tongue representation, such as a digital heat map or a graphic representation of the tongue, so that the patient can add digital pins or annotation to indicate things like the cracks, the coating, or the blister that happens to exist on the different part of the tongue for a more accurate diagnosis. And then third, the solution must be able to provide patient with a preliminary diagnosis survey or any other variants to capture patient response and input their current condition in order to streamline the consultation process. And then fourth, it must include a tongue image database with machine learning capabilities so that patient-centric data can be captured and collected. So over time, with the large database of the tongue images, the solution machine learning capabilities should be able to offer TCM practitioner a list of preliminary symptoms or the recommended diagnosis and prescription. And then the fifth, the solution must allow the export of the patient data and tongue image to the existing digital clinical management system or the electrical medical record software. And then it must have English and Mandarin language option. 7, it must be user-friendly, definitely, and intuitive to guide the less tech-savvy user to capture the accurate tongue image and must be mobile-friendly. And then 8, it must adopt a plug and implementation model so that it can be first integrated into the mainstream telemedicine apps with video conferencing function. And lastly, hopefully, if possible, the solution could also have a data mining and management system to facilitate the data mining of images, health condition, symptoms analysis to identify the health trends and possibly preempt the possible health outbreaks. So here are the possible use cases. First, we have the TCM practitioner as the user. So with the solution, the TCM physician is able to get a clear tongue image and completed the pre-diagnosis checklist or survey from patient prior to the teleconsultation session. So through the tongue image and pre-diagnosis checklist, the patient respond during the video teleconsultation. Doctor will be able to receive an intelligent recommendation on the possible symptoms and is able to make accurate diagnosis without the face-to-face interaction. And then all this information is able to be automatically updated into the clinic EMR system. And then next we have the patient user who is less tech savvy. So she is able to navigate the solution easily with clear instruction given in her preferred language option, in this case in Mandarin. And she is guided to take several image of the tongue, which is auto-corrected for white balance and saturation level to ensure that accuracy and high image quality. The solution then proceed to conduct a pre-diagnosis survey, which prompt a specific question and suggested possible symptoms based on the result of her earlier tongue analysis, so that the TCM practitioner has a clearer understanding of her condition pre-consultation. This helps to shorten the times for remote consultation and to increase the accuracy for the diagnosis. So what's in it for you? For this, I think everyone is almost the same. We given 20K prize money for the winner for this challenge, and the winner can gain access to the team of experienced TCM practitioner and gain the resources from IMDA and co-innovate with the MOH TCM practitioner task force and the opportunity to commercialize the solution. So this sector-wide challenge is actually a collaboration between Doctor Plus Wellness and the TCM community, the Ministry of Health Traditional Chinese Medicine Practitioner Task Force. So Doctor Plus Wellness is a Singapore-based company. We have developed Doctor on Click, an integrated healthcare workflow platform, which aim to improve the patient outcome and reduce the healthcare costs through virtual doctor visit. The sector lead, we have a MOH TCM Practitioner Task Force. It was first set up to enable TCM to play a large supportive role to fight against the next disease outbreak. The supporting member for this challenge will be the Academy of Chinese Medicine Singapore, Singapore Chonghua Medical Institution, Singapore Tongchai Medical Institution, Singapore College of Traditional Chinese Medicine, and NTU Chinese Medicine Alumni Association. So similar evaluation criteria, you will be evaluated based on the solution fit, readiness, solution advantage, and your company profile. Okay, thank you. We'll go to our Q&A session for now. Yeah.
Thank you, Jesslyn. I think you do have your colleagues who are joining you for the Q&A session as well.
Yeah, so we have our...
perhaps you just introduce them.
Yeah, so we have Dev here who will be answering all the IT related questions. He's the director of the company. Yeah.
Hi, Dev. Good afternoon. Thank you so much for joining.
Hi, everyone. Hi, thank you. Let me know if any questions relates to technical side have. I can answer that. Relates specifically to AI, machine learning, or integrations.
Sure. Okay, there is one question. I'm not too sure is if we are to profile the users, we might need to collect basic info required for profiling, analytics, and stuff. So
basically, the data will be, we will be collecting, you will be producing a prototype of app, basically, and we will be all the data will be stored on DPW's cloud storage, and then it's will be specifically, it's not will be, data will be not belongs to you guys. It will be just to train the model, and will be still will be back to the clouds here. So you have to access from the clouds, train, and put it back. So we will preferably try to use the cloud solution for training the models will be better. So we can help you to link up.
thank you. Okay, there's one question from my anonymous attendee. Are you looking for an on-cloud or on-prem solution?
We're looking for a cloud-based solutions. Basically, in a start, when we are collecting the data, we need to have a small prototype of app where we can just collect the pictures and basic informations, and we can slowly put it, the whole things in the clouds. And eventually is a RESTing API going to be, so it can be integrated to different peoples who are partners, as well as you can scale it up to the market.
Okay, there's a question from Mike Zhang. Are there other data that could be used for the TCM doctor to better assess the patient?
So for us, generally, we will just do the face-to-face consultation. So in this case, we'll work with TCM's community site to provide you with more of the accurate data and from the different expert in the TCM community. Yeah.
Okay, thank you. Okay, there's a question. How are you envisioning the 3D reconstruction for heat maps and texturing?
So for this, when you take a picture of the image, generally it's in 2D shape. So hopefully, like the image, we can twist and turn and look at the image of the tongue, because for TCM physician, we don't just look at the surface 2D image, we look at the side and the underneath of the tongue. So hopefully the solution can guide the user to like flip their tongue or take a different angle so that it can come up with a 3D solution.
Interesting. Good question. Thank you. Okay, let me see. Any other questions? The 3D through photogrammetry process requires processing. I'm not too sure what question that is.
Yeah, I don't get the question as well.
Are you able to see the questions in the Q&A box?
Yeah. I'm not too sure about the 3D through question.
Yeah,
here.
from Azhar Malik. So Azhar, if you are still online, perhaps you could just clarify a little bit. There's a question. Are there any current image databases that you guys are currently using?
For now, we don't have, so we're looking to work with the partners. So like we'll have TCM physician to help taking the image and then give you an idea of what is the actual diagnosis. Yeah, so for now, you can just look up online to show us what is your proposed solution, and then we can work together to improve the database eventually.
Awesome, thank you. Okay, any other questions from any solvers? While waiting for additional questions, I'm not sure if Dev or Dr. Laura, you'd like to add anything to the discussion for the solvers?
I think for the solver, it's a great opportunity to be launch something involved into medical field and evolve, because this is with the whole community support, So specifically government agencies are also involved to support this project. So I believe you guys have to really can accelerate this to the whole community of almost like 3,000 over community peoples in Singapore, as well as to worldwide, I believe, eventually. Because TCM industry is looking for these image classifications. From there, you can really accelerate and add on other features in it to be, that's, so you need in a start a little bit brainstorming how you're going to do that. But this will be a very basic image classification model, as you can understand that. And so it should be.
Thank you, Dev. Okay. I don't see, there is one new question from an anonymous attendee. Are you available for high-end hardware for processing? I think if it's a cloud environment, I think hardware is not an issue.
It's not feasible for the whole community because you keep moving it one place to other. It's totally disastrous.
Yeah. Okay. So maybe I'll just share this perspective for the solvers. So there is a difference between enterprise challenges and sector-wide challenges. So for enterprise challenges, the problem statement is unique to the enterprise. For sector-wide challenges, the sector lead is obligated to propagate the solution to the rest of the sector. So there's a huge opportunity for the solvers out there. Okay. Azaha has clarified. So the question was 3D reconstruction through photogrammetry will be rendered on your cloud. Is that correct?
Dev, you might
Dev?
want to answer this question.
If you see the Q&A bar, there's a question by Azhar Malik. The 3D reconstruction through photogrammetry will be rendered on your cloud, on the cloud.
Yes, yeah. So yes, Azhar. Yeah, it will be.
Okay. So, okay, I think we shall move on to the next section. Thank you so much, Dr. Laura. Thank you so much, Jaslyn. Thank you so much, Jess. If you could just stay on to type out any answers to some of the questions that will continue to trickle in. With that, on behalf of IMD, thank you so much for participating and being here with us today. Thank you so much.